Hello, and welcome to Bioidentical Hormone Replacement Therapy webinar, often known as BHRT. This is part one of two parts and will take approximately 20 minutes. I'm Nancy Lamb, and a pharmacist with Good Day Pharmacy, and I hope I can help you understand more about your hormones and things to ask for when you're considering hormone replacement therapy. The goals and objectives. I want to provide you a basic understanding of terminology, to provide information to better equip you when speaking with your practitioner, to gain a general understanding of the Women's Health Initiative study and why practitioners may be concerned about prescribing any hormones, to understand estrogen, progesterone's role in the menstrual cycle, and why cyclical use is recommended in some women, and to understand the role of each hormone, to give you an introduction to saliva testing that is available, to help you better understand the factors involved with obtaining hormone balance. First of all, what is compounding? It's the traditional method of preparing customized medication to help meet unique prescriber and physician and patient needs. Compounding versus manufacturing. Manufacturing. There's no specific patient in mind when a drug is produced. It's an average of what people might need. It has nothing to do with each individual's differing needs. And prescribers try to match the patient to the products that are out there. Compounding, we make the formula to match the patient's specific need. We try to have the drug ready to administer to the site of action in the most effective dosage form available. The triad. It's important for you as the patient to have members on your team. You want a pharmacist and a prescriber that can help come up with the best therapy for you. The compounding pharmacist works together with patients and prescribers to provide customized hormone replacement therapy. We provide it in the best strength and form to meet each individual's needs. Terminology. This can be very confusing. BHRT. What is it? It is bioidentical hormone replacement therapy. Bioidentical hormones are derived from natural plant sources, as are most hormones. The important part is they are identical to human hormones. They have the exact same molecular structure. I like to tell people it's like water. Only H2O is water. Anything else with any other groups added to it is not water. Bioidentical hormones are the same. You want the hormones you're taking to exactly match your natural hormones, because then they will provide the same physiological responses. So when you use them, your body will respond to them the same way it responds to your natural hormones. They also should be taken in a manner that imitates the body's natural production and balance. Terminology again. Natural hormone replacement therapy. This is a term of confusion. It may mean found in nature. Natural may, to some providers, refer to phytoestrogens like black cohosh, or alternative therapies, or horse urine, or synthetic therapies. Bioidentical hormones are natural, but natural may not be bioidentical. Premenopause, in general, a collection of symptoms experienced by women for 10 to 20 years prior to menopause. Perimenopause means right around menopause, meaning the year or two before, during, and after menstrual cycles end. Menopause means the ending of menstrual periods. Postmenopause literally means after menopause or the stopping of periods. Hormone levels still fluctuate, typically up to 5 years after menopause. Compounding. It's the art of mixing and making formulas according to prescribers' orders that are specific for one single patient. A compounding pharmacist has undergone specialized training to offer more of a medication therapy management perspective that is not restricted to what's available commercially. Progesterone. It's the primary hormone of fertility and pregnancy. It's also our calming hormone. It's mainly secreted by the corpus luteum, and it's secreted when you drop an egg and it doesn't get fertilized. It's the follicle that remains behind that produces the progesterone. When you don't drop an egg, you do not produce progesterone, which is why when women are aging and they have cycles where they don't drop an egg, their body's level of progesterone goes down. Progestins. A progestin is not progesterone. Progesterone is the exact name of the bioidentical hormone. Synthetic or chemically altered progesterone-like are progestins. They may act like progesterone on some sites, but they are not bioidentical. So it might imitate progesterone in the uterus and help you to slough your lining, but elsewhere it often causes the opposite and dangerous effects of what is caused by progesterone. Examples are below. Medroxyprogesterone is the most common. Norethindrone is often in birth control pills. These are not human hormones, and they cause problems in parts of your body. If the horse wouldn't take human estrogen, why are we using horse estrogen? There was a study called the Women's Health Initiative. It was funded by a drug company to help evaluate their products for menopausal women. Their goal was that it would show improved health by all women and therefore increase their market for their product. They used synthetic, non-bioidentical hormones. That's because they could patent those hormones. They caused many problems: increased breast cancer, increased stroke, increased heart attack, because they didn't do what normal bioidentical hormones do. They actually had opposite effects in some parts of the body and increased risks. What they used was horse urine estrogens, which are not identical to human estrogens, and synthetic progestins. So they did not use progesterone. Hormone therapy is not one size fits all. This is especially true for women. What changes the therapy needed? Everything. Age, history, family history, symptoms, whether or not you've had a hysterectomy, your body size and shape, other disease states, and much more. He just doesn't understand what it's like for me to go through the change. And that's true for many of us. Cortisol. Be sure that you check this. Cortisol is a stress hormone. It's designed to give bursts of energy to escape a dangerous situation, like running away from a tiger. Though modern life often convinces our brains that everything and every day is stressful, we stay on high alert all the time, and this unbalances all the other hormones. I like to show this slide because many people have heard about pregnenolone steal, and it also shows how when we're under stress, it unbalances our hormones. Here is pregnenolone. Here is also your bad cholesterol, your LDL. And you can see we all need some of it because it is the starting factor for all of our hormones. When we're under stress, we drive this orange pathway right here, and we make cortisol because we're under stress. And therefore, instead of making progesterone, our antidepressant relaxing hormone, we end up making cortisol. And also, instead of making all of our estrogens, we make cortisol. So when we're young, and if you are young and having problems with anxiety, stress, depression, it can be that you're driving this cortisol pathway and depleting your progesterone. And this unbalances all of your hormones. It's important to keep these hormones in balance with progesterone. One way to find out what's happening in your body is to do a saliva test. You can pick these up for free at Good Day Pharmacy and take them home. You don't pay anything until you send them in, and there's a form included that you fill out and you pay the company directly. We just stock them as a convenience to anyone that wants to test their hormones. This says saliva and blood, but the blood's not necessarily used for cortisol testing or hormone testing. You're going to use the test tubes. You're going to test cortisol and DHEAS, which is imbalance in your body with DHEA, and DHEAS is what you test. You can also test your hormones if you have not had them tested in your serum or blood at the doctor's office. Cortisol, you want to test 4 times in one day. These are the 4 tubes. And you start with the morning tube, and you only fill it half full with saliva. Yes, you spit into these tubes. Since you wake up in the morning with very dry mouth and little saliva, the morning tube takes the longest to fill, and you can't drink, eat, or take anything before you fill this tube. So you fill this tube first. Oh, sorry about that. You fill the large tube first and plan on it taking 30 minutes. Then you fill the next 3 tubes, one at noon, one in the evening, and one at night. They will not take any time to fill at all, probably 2 to 3 minutes. The cost is about $140 to do a 4-point cortisol plus DHEAS. Again, a 1-point cortisol at your doctor's office is not helpful because cortisol changes significantly throughout the day. So you don't know what your cortisol is doing unless you test all 4 points. You can also, for $210, do a 4-point cortisol plus your DHEAS plus all 3 hormones, progesterone, estradiol, and free testosterone. With the kits is a symptom indicator. You'll fill out this hormone balance test. It tells you you rate your low progesterone symptoms, your estrogen, and low testosterone. And you can see many of the PMS symptoms are coming from progesterone. It's depressed, difficulty with sleep, moodiness, painful swollen breasts, weight gain. You also want to know if you have more estrogen than progesterone. So they could both be low, but your estrogen might be higher than your progesterone and therefore out of balance even though they're both low. And that's important to know. And adrenal fatigue is what we're testing with cortisol. And it has many, many symptoms. More than one hormone can cause the same symptom. Hot flashes, weight gain, anxiety, mood swings can be due to maybe too much estrogen and not enough progesterone to balance it. More is not better. Too much of one hormone can look similar to too little. Balance is important. You can't restore one hormone without balancing it with others. It's important if you're taking estrogen that you're also taking progesterone to balance it. If it seems complicated and you would like an individual consultation, we do offer that. The initial appointment with our hormone consultant will review your health history, your symptoms, and your issues. She'll recommend hormone testing if it's appropriate and tell you which ones you should do. There'll be a follow-up appointment where she reviews the hormone and cortisol tests for you and makes recommendations. These recommendations will be written and provided to your practitioner and a copy for you. It's an extensive consultation, but you can set one up at the pharmacy by calling 970-224-1212. Our consultant pharmacist will contact you to schedule an appointment. The cost is $150. This can be done in person, or for some people who cannot get to the pharmacy for an appointment, we can do it through a remote FaceTime or Skype or phone call. This is the end of part 1 of 2 parts. Thank you for listening, and I hope you've learned some things you can use when you work with your practitioner.